All right, welcome back to MDTV. It's March 18th, 2020. Let's get into it. All right, so as we all know, the coronavirus continues to extend its way across the globe. And today we are just expanding on what we talked about last time. We're going to compare the chart we saw from the data on March 13th to today, March 18th, and kind of see if we can compare and contrast some of the trends. Okay. So cases outside of China and South Korea continue to accelerate, going up, up, and up. All right. And remember, the first point on this graph here is when the first case was detected. So somewhere just before December, late November for China. And the second point, so right here for China, for example, is the point at which the cases reported started to grow exponentially. And then the third point is when this started to level off. And of note, there's only two third points. You guessed it, China and South Korea. All right, so um, a couple things to note here is that as we've gathered more data, I said in my last video, the first case reported in the USA was around January 30th. Turns out in Washington, it was reported near January 20th, 21st. Um, Another important or interesting fact is that the same first case was reported in South Korea that same day, so on January 20th. Okay, and so we can kind of use some inferences to see what we're dealing with here. All right. So let's just take a look at South Korea. South Korea reported its first case January 20th, 21st, and then had this point in time before it started to see an exponential increase in cases, and then um, about March 8th, so right here, South Korea started to see a leveling off. All right. Another important thing, remember I said last time, is these curves, the true curves, will look something like this. Okay. But just keep that in mind. Um, Coming back to South Korea, we can sort of analyze their timelines and analyze what they did and kind of infer what we're dealing with here in the US. So, again, South Korea heavily quarantined from the very beginning. They started quarantining at around case 30. Now, the caveat to South Korea is they actually had something called case 31, which was a super spreader. And the idea is this one person actually spread this virus to, I think, thousands or at least hundreds of people in South Korea. But the fact is that South Korea was able to effectively contain this by massively quarantining and massively testing everyone that potentially was exposed. Okay, and they were able to get a leveling off and control over this very quickly. Now let's look at Italy. Italy had its first case around January 31st. Okay, they started seeing exponential increases around February 23rd, and today they are increasingly suffering, and I think their case reports are around 35,000 and counting. Okay, so Italy is in trouble. They also have the highest death rates, and we'll go into that further later. The USA, look at this lag time here before we start seeing this exponential increase around March 2nd. Where today the USA is just under 10,000 cases and counting. But we'll talk about the amount of tests being done and why this number is not accurate. Okay? All right, we'll come back to this. So, interestingly, last time from March 30th, we saw the numbers overall, besides South Korea and China, were much less and growing. All right. And today the numbers continue to get worse. All right. All right. So couple interesting things here from the worldometer chart. Again, China is leveling off around that 80,000 mark. Italy continues to see a dramatic rise. New cases, almost 5,000 in a day. I mean, that's just crazy. USA increasing. What I want you to look at here, though, is a couple interesting columns. Number one is the active cases going on. Look at Italy relative to the other countries of the amount of active cases. This is what's contributing to the total deaths. Okay, and so we're going to see a continued increase, unfortunately, in the total deaths in Italy, whereas the other countries that have this under control or more under control, um, you're not going to see the death rates rising as much. Another interesting column to pay attention to is this total cases per 1 million. So this is kind of a fraction of the population affected by this. And so I like to think of it as kind of the percentage of the population or the country that's taking a hit. You see Italy here, 591. I mean, that is so much worse than China, 56. Okay. Next largest percentage of the country, Spain, Iran, and so on down the line. But look at this, 28. Now, some people may look at this and say, oh, hallelujah, 28 for the USA. Why would this be? If we see such significant lag times here, you would think that the USA should be shooting up. Well, the truth of the matter is that the USA is not testing, or I'll say this, their testing is far behind other countries. We are testing. We're just behind. Now, this is a report from March 13th, which I know was 5 days ago, but you can gather some important trend data from this. So you look to see where the USA is in their tracking process, and we see we're way down here. And look at South Korea, look at Italy. This is a province in China, UK, Taiwan, and so on down the line. But the point is that USA is far behind on the number of people being tested. This is a fraction of the population that has been tested. So tests performed per million. Look at USA way down here, way down here. And I know that we are increasing our testing rapidly, and that's great. However, we are behind the ball big time relative to all of these different countries. All right. All right, so let's get into some of the death rates. So, death rates vary widely, and as we've seen, Italy is taking the hardest hit. We'll explain why in a little bit. All right. China, interestingly enough, their death rate is around 4%. But if you break this down further, you look to see the death rate within the Wuhan or Hubei province is going to be much higher relative to the death rate outside of that province. All right. Now, what does that tell us? What does that tell us? Now, I don't know the exact numbers, but I want to say that the death rate in Hubei is greater than 6%. And then the death rate in China outside of that province is 1%. Okay. Now, these numbers may be off a little bit. Maybe the death rate in Hubei is 7% or 6.9%, or this is less than 1% or whatever. The point of the matter is outside that province, the death rate is significantly lower, whereas inside that province where the virus began and originated, it exploded, and the Hubei province suffered in terms of death rates, and Italy is suffering in terms of death rates, and we will see why in just a second. All right, so this graph right here, I want you to ignore this and even all this. The point is to highlight this area, okay? Specifically this point in time. And you may ask yourself, why is social distancing so crucial to curbing this virus? And here's your answer. We have from the data that at the point at which Hubei went on lockdown, you see a leveling off. This is number of cases per day. So the number of new cases per day is going down. And I could spend a great deal of time explaining everything on this chart, but I just want to make one point, and that is the second that you quarantine people in a dramatic fashion, then you can significantly reduce the amount of new cases you're seeing per day. Let's move on. One of the scary things is that this virus continues to increase dramatically, and it actually doubles on average of 6 days. So what does that mean? Well, this chart right here I just included to hit home the point of that some of these countries are seeing doublings every 2 days, all right? And yes, the USA is past this line, all right? Now, this was taken from Valuetainment, and the amount of case doublings is broken down per per 4 days, 6 days, and 10 days, and it tells you at what point in time are we likely to see significant case doublings, right? So you've all heard the thing where you put 1 penny on the first of the month, and then by the end you have, I don't know, $67,000 or $1,000,000 or something. If you double it every day, you saved a penny on the first of the month. Double it every day, you're gonna have some astronomical figure by the end of the month. It's the same idea here. So if we continue, let's just pick 4 days. I think on average, the real fact is that the coronavirus worldwide has been doubling, I think 6.2 days on average, but in a lot of countries it's doubling faster than that, and we'll just take 4 days as an example. Okay, so this is saying that where are we? We are close to March 20th. We're well past 4,000 cases. We're already at 8,000 cases. So if this trend continues, you're going to see the amount of cases just explode in the next coming weeks. Now, I'm not here to say that that's going to happen. Just bear in mind when you are considering the exponential increase in this and the rate at which we are going, this just mathematically shows you where we are heading. Not to say it's going to happen. Mathematically, this is the model. All right. Okay, so this is the point that I really, really want to hit home in this video, and this is why Italy is suffering, in my opinion. There's multiple reasons, but I think this goes to show us probably the biggest reason why Italy is suffering, and Italy's not included formally in this list. I'll just put it here. Italy has 3.2 beds per 1,000 people, okay? So you can see the countries, the breakdown by country about how many beds they have per 1,000 people. Japan, South Korea, way ahead of the pack. What did South Korea do? How did they level off? Well, they massively quarantined, they massively tested, and they have the healthcare capacity to take care of the patients that need care. All right. What happened in Italy? Well, Italy was too late to the party, and by the time they started seeing a rapid influx of patients into the hospital, it was already too late. They don't have enough beds to take care of the amount of patients coming in, right? And this is scary. I'm not going to lie. This is scary, okay? Because the US is sitting very close to where Italy is in terms of bed capacity. And I listened to a podcast with a physician, an ICU physician that's working in a COVID unit, and he said he's working as a critical care pulmonary specialist. He was taking care of a patient that needed immediate attention. At that exact time, there's a patient that's being wheeled up into the ICU that also needed immediate attention. So he's being pulled in both directions at the exact same time, and both these patients are critically ill and need attention immediately. At that exact same time, somebody is paging him from the ER with another patient. They need him down in the ER immediately to attend to this third patient. Okay? So doctors can't be in three places at once. And that's what the problem is here. That's just going to show you healthcare staff that's being pulled in multiple directions. That's not to say, oh, well, sorry, we don't have a bed for you, or a bed's not available for you. And there's certain hospitals already in New York that are already at capacity, at ICU capacity. So we need to get on this. Um, we need more ICU beds. We need more facilities that can handle these patients, and we need that now. We cannot wait any longer. We've been behind the ball long enough. It's time to act. We've heard in the last few days this idea of flattening the curve, and I just want to expand on this a little bit and just wrap everything together from our discussion today. Um, the idea is that when you see such a rapid increase in the amount of patients coming in, the healthcare capacity, as we've been saying, it's only right here. Let's just take US for example. If there's only 2.8 beds per 1,000 people, what happens when 100 people come walking through your door that need ICU care? Well, this represents undesired deaths, or it's deaths that should not have occurred if the healthcare system was able to meet capacity. Okay. Now, there's two ways to combat this. One is increasing this bar right here, is moving this up. How do you do that? Well, you get more ventilators, you get more hospital staff, you get more beds to house these patients. But that has a cap, right? We have to flatten this curve. And the idea here is that by social distancing and quarantining and not spreading this, then we're able to actually flatten this or decrease the rate at which patients are being infected and ultimately needing care. Now, if we do in fact spread this out, then if we just took the area of this versus this, there may be close to the same number of patients being infected total overall. But the point is that you have all these unnecessary deaths that are occurring up here because of the fact that you have saturated the healthcare system capacity, and that's what's going on in Italy, and that's what we fear is going to happen here in the USA. I want to finish with just an expansion on what I talked about last time with the transmission of this, and I really focused heavily on the transmission through the air. And of course, you can transmit this through the air, but I wanted to expand this time on why it's important to sanitize everything, not just be careful with breathing, coughing, sneezing, and all that. But what happens when somebody breathes or coughs, then a lot of these large particles end up just falling straight to the ground, right? And these things can live anywhere from hours to days, depending on what surface it comes into contact with. So imagine this. Imagine walking through a COVID center and you have all these particles just all over the ground. Well, imagine how infected these shoes are, right? So everywhere you go, you're just going to be carrying this with your shoes. So the point is that they're they're starting to show that shoes, taking off your shoes when you come home, actually can help reduce the infectivity rates. All right. Now I'm hoping to kind of leave this discussion with, I guess, some optimism, if you want to call it that. But the point I want to make here is that the latest statistics have told us that up to 80% of patients infected with the virus will not know that they have been infected, which means that they can still transmit the virus to anybody they come into contact with, but they won't know. Which that's good news, right? And so this is just showing right here that out of the 5 people here that are infected, only one of those 5 are going to show symptoms. Okay, so this person's showing symptoms. Now, there's other estimates that have come out that say the 70% of the world's population is going to be infected by this. So we included 7 people in this row here, and 2 out of the 7 are not infected, whereas 5 out of the 7 are, right? And then 1 out of those 7 are going to show symptoms. So if we kind of expand on this, then you can see that out of this grouping of people, only 5 are going to be infected, and out of those 5 infected, about 1 needs hospitalization, and you need multiple of these groupings and ultimately hospitalized patients before you get one death. But again, this goes back to that same point of healthcare capacity. And if we don't have enough equipment, if we don't have enough beds, if we don't have enough healthcare personnel, if we don't have enough protective equipment, and so on down the line, we're going to end up going in the exact same direction as Italy, because that's where we are headed. If you have not checked out this article, I highly recommend you do so. I'm going to throw the link in the description box. And you don't even have to read the article. Just click on the simulators, because it shows you exactly how this virus is transmitted and the whole idea about how this spreads. It's very, very informative. And as we see a continued increase in cases and deaths, our hope is just to flatten this curve and learn from what Hubei, China did, and learn from what South Korea did, and not make the same mistakes that Italy did, and move forward with knowledge and action in order to beat this virus.